think most of you know me. I'm Darrell Weaver, the administrator for Baptist Hospital here in Carthage. You probably all saw the article that came out this past week that said, national study said that Mississippi has more rural hospitals at risk of closure than any other state in the nation. Why is that not surprising? I'm not here to ask you about your position on Medicaid expansion. That's just a dirty word with a lot of people. But what I am interested in is what opportunities or what level of importance you all are placing as two separate bodies on the issue of expanded insurance coverage of some sort. The point being, if we don't, and I'll address this to Jason because you've been so great to work with over the years, real supportive of healthcare. Do you see any solutions, or are we going to have to drop 15 hospitals out of Mississippi's small communities before somebody goes, there's a problem?
You addressed it to me,
Only because you're a friend of healthcare.
Well, I kind of, my first year as a freshman 7 years ago, I was looking for something to do, and as freshmen, they don't let you do a whole lot, and mainly because you're dangerous. You don't know what you're doing. But I fell into the healthcare realm because that's, for most people, that's not a very sexy topic to talk about Medicaid and these types of things, and they get very technical when you're talking about a federal program and how the state relates with it. It's very complicated how y'all are reimbursed and all of those things. We spend as a state, our whole state budget is a little less than $6 billion. General fund, $6 billion. We spend over $1 billion, right at $1 billion, give or take, on Medicaid for the match that comes from the feds, which is $4 to $5 billion. So what we receive from the feds for Medicaid funding in Mississippi equals our total state budget that we spend on everything else. I'm talking from highways to law enforcement, running all facets of state government. We spend an equal amount of dollars on Medicaid in this state. Almost, not quite, 1 in 3 people in Mississippi are on some type of Medicaid, the federal program. So when you start, that means if you're at the red light right out here on the 4 lane, if you look to your left and right, one of the 3 of it is probably on Medicaid, which the state pays about 1/4, and the state pays anywhere from 20 to, well, now we have some that the feds pay a little more and some a little less, but roughly the average is about 23%. The feds kick in the rest on most of our Medicaid beneficiaries. As expansion talk has now popped its, I would say, ugly head back up, because what I'm worried about is where do we get eventually our match money? Now, there has been some creative talk of healthcare providers possibly being willing to pool their assets and be willing to carry the burden of the state match on any new enrollees in any sort of innovative program that would expand some sort of health care to individuals who are caught between the Medicaid gap and being able to afford insurance or their employer provide insurance. So it's something that's continually looked at. Hospital associations on the forefront of that, as you know. Here's what I would say about our rural healthcare system, though. And this is a prime example here in this community and in Attala County. You've got to be able, local leaders and stakeholders have to be willing to think outside the box when it comes to, number one, saving your hospital, saving your health care, enticing doctors to come to your community. And I think y'all are a prime example of a place that has done that. You could have sat on your hands a few years ago and, that hospital might not be out there like it is now with a great partner in Baptist there. And I'm tooting your own horn there, but the same thing in Attala County. We were faced, Mumford Jones was fixing to close. It was done. Had they not, the supervisors, that's a county-owned hospital, had they not kind of started looking around saying, what can we do? And Baptist was willing to come in and partner. And a lot of people say, yeah, well, Baptist is just sending those folks on to Jackson. Maybe they are sending some of them on to Jackson. But you know what? When my dad had his brain bleed and had his stroke, if they hadn't been out there and a place for him to go, we're an hour and 15 minutes away. So whatever form it took, I was glad it was there. And so communities have got to reposition themselves and think about the changing face of healthcare and what it's going to take to keep their facilities in place and attract doctors. That's kind of the key to it.
Ms. Dodd, can I expand a little bit further on that? Well, Darrell, I will tell you, just currently, from a legislative standpoint, we've got a bill before us, we do in the House right now, the House Medicaid Committee does, 2439, I think, that would allow crossover pay, or managed care more or less for nursing homes across the state. Now, I know y'all don't have a nursing home out here, but here's the deal, when you get managed care, and they're trying to save dollars, so if we're going to start allowing the lobbying interest of managed care to get over into the nursing home side, you can get ready, if that happens, it's gonna pull dollars, Medicaid dollars from the hospitals. So we got to be, as we move forward, and it's my understanding as of Friday, that if there's not an agreement reached between the managed care companies and Medicaid, that legislation will die. And I am not in support of this legislation, I will tell you, for that main reason. They go in and they're going to, the very precious few dollars that we have that's coming out of managed care, from Medicaid, you start putting it into nursing homes, which I'm all for the nursing homes, I understand that. But you're gonna be pulling it from the rural hospitals too, which is gonna put it at even more of a risk of closure and stuff like that. So, conversation I had as of Friday afternoon, and Jason may can expound more being on Medicaid, is that if we don't have an agreement, that bill will die, which in my estimation is I go back, a solution looking for a problem. I don't think we've got a problem right there, but we'll see how that plays out. So I just wanted to add that caveat a little bit more of where we're at currently. I think I'm right on that, am I not correct?
The deadline is tomorrow.
Thank you all for everything you do for